Hi there, everyone. Will Dupree in the KXAN live studio. We are in the midst of about to bring you a virtual press briefing by the Texas Restaurant Association. The leaders of that organization, which is a trade group here in the state, are talking about the reopening plans because all restaurants are going to be allowed to reopen tomorrow at 25% capacity. So let's take a listen as they talk about that and address some of the concerns that restaurants have here in the state.
Does not.
Yeah, it was never the intent that the order required or counted staff or the essential workers in the count of the 25% capacity. And so we've been working with the governor's office. We received clarification. We've been sharing that across the state, which is that 25% does not include your essential workers, who are essentially the folks that are going to be taking care of your customers. And so it's really important that that message gets out. We've got a letter from the governor's office we've been sharing with restaurants and owners and health departments. But one of the things that's been very important about the governor's order is consistency across the state. And I think we need to continue to see consistency because it's how our diners and our restaurants are going to begin to work together and learn this new world of dining in, restaurants across Texas.
Perfect. And then what are looking at the results we had, Emily, of the quick poll that we did yesterday on which restaurants are going to be opening up around the state. Are you surprised at the results that it's basically down the middle with slightly more saying they're not going to open?
I wasn't surprised, maybe more pleasantly surprised that more are choosing to open than I would have maybe thought when it first came out, because Monday to Friday was maybe considered quite quick. We'll probably do further analysis, but it would seem that those that have had really strong drive-through or curbside and takeout and delivery may be the first ones to move. Some of our smaller independents that already have limited seating, when they look at the math for them, it may not make sense to open at 25%, even for a couple of weeks. And so I think we'll see a pretty clear line around those that may have already been in operation that can simply expand into the dining room while they still have their other revenue streams moving. And then we'll start to see those independents jump online in the next couple of weeks.
Right. Kelsey, for you, we have a question about the 51% alcohol revenue signage and why they're excluded from Governor Abbott's order. Can you talk a little bit about that?
Yeah, absolutely. There has been a little bit of confusion, but I think the best thing folks can do is go directly to the executive order, because that's really where Governor Abbott is setting the law for the state. And the executive order is clear. I'm just going to kind of read it straight from the page, that dine-in restaurant service is available, but it only applies to restaurants that have less than 51% of their gross receipts from the sale of alcoholic beverages, and are therefore not required to post the 51% sign. And talking to the governor's office, it's very clear that it's that 51% piece that determines whether you qualify or not. There's some semantics about signage and who has to post the sign or not. That's really kind of beside the point. The line in the sand is, if you get 51% or less than 51% of your gross receipts from alcohol, then you are allowed to reopen your dining space. And in talking to them, it's clear that they want to bring bars, taverns, other establishments online as soon as they can. But right now, social distancing is really the key, at least one of the key components to a safe reopening. And so they're worried about crowds, about people congregating. And so I think that's really where that concept comes from. And we're fully supportive of making sure that those social distancing and sanitary guidelines are in place and are being observed.
That makes sense. Texas has a very tempting spring, and it's very tempting to get out there and be around a lot of people for those patio drinks. We certainly understand that. So let's talk a little bit about the Texas Restaurant Promise and the guidance that we've issued to our both members and non-members within that. Emily, can you talk a little bit about where this came from and how we are distributing it?
Yeah, I'm actually really proud of the work that was done. So about 2 weeks ago now, we assembled a group of thought leaders and really experts in both the chain, some of our largest chain partners and our independents across Texas, and we drafted this promise. And we first sent it to Lieutenant Governor's task force team. We then sent it to the strike force and included a lot of information with food safety, sanitation. We used the FDA guidelines. We incorporated quite a bit and said, really, we believe this is the best way to reopen as you allow our restaurants to begin serving people in their dining rooms. And so when the governor issued his guidelines, we were certainly very pleased. One, that there was consistency across the state. I think it's really important. We have operators that operate in so many counties and cities. To have inconsistent guidelines would make it very difficult, as well as looking at the broad spectrum of protocols. He did include both customers and restaurants. And I think that's a very important part of the promise, which is there's a very clear set of guidelines. The guidelines in our promise now match the minimal health protocols the governor released. So it's a very clear sheet of guidance for every single operator, but there's also a set of guidance for customers. And I think that's a very important message about the promise, which is together we promise to be safe and we promise to help Texas restaurants open and to sustain that opening through the several months that are ahead of us. And so what I think is probably the most heartwarming is that we've seen dozen at this point states mirror the promise in their own work with their own governors. So we really believe we've hit something that's going to work, and we really encourage all restaurants to make sure that those minimal health guidelines are met and that they post this so their customers are aware of what is expected as they start to enter their dining rooms again.
Great. Okay. And then a little bit more on the promise, Kelsey, because once we got Governor Abbott's order and his additional guidance, we changed the restaurant promise, correct? What kind of changes were included in that?
You know, a lot, like Emily said, we were really grateful that the work we had already been doing for weeks was really reflected in what the governor came out with. And I think that's important for people to know. You know, on one hand, yes, it seems fast since he made his announcement Monday, but really this process began long before that. And it began with looking at the CDC guidelines, the FDA, what other states are doing. Although, as Emily said, we're now seeing them follow Texas's lead, which is great to see. But we did, once the guidelines came out from the governor, we made sure to go back and truly wordsmith and just make sure that, you know, where the governor said something needed to be disinfected, that we specifically use that word and that phrasing so that there's consistency across the board. You'll hear us say that over and over again. We really think that consistency is key, not only for our operators who are having to adapt to a very changing world quickly, but the last thing they need is kind of ever-changing protocols that differ across the state. And it's the last thing our customers need too. We need to send one unified message about how to keep everyone safe. And we need that to be a clear, uniform message. So we're just really happy to be involved in that discussion and collaboration and think that the Texas Restaurant Promise reflects that work.
Do you have any feel for how many of the restaurants not opening are currently operating delivery or takeout? We're assuming, of course, that restaurants that are not going to open tomorrow but are still operating will continue operating delivery or takeout. Do you feel that way, Emily?
Yeah, absolutely. So I think if they're already doing, you know, one of the things the governor also did was maintain the orders or the waivers that were for alcohol curbside, as well as for retail bulk items. And those two really have been, I think, a godsend for some restaurants, right? To be able to actually increase their revenue stream through those two sources. So those will continue. And so you do have restaurants saying, right now, economically or from a personnel or supply standpoint, it doesn't make sense. And I'm surviving. I'm certainly not thriving with curbside delivery and drive-through. But if I can make it a couple more weeks as I start to get my business built back up again, that might be the best option for them. So I think that you'll see, versus those that may have been completely shuttered since the middle of March, we don't have a take yet on how many of those will reopen. I think we'll see that through the weekend, and we're tracking it very closely. But I think if you've already been working along, it's going to be a little bit easier for you to get your dining room open.
Perfect. Okay, so now we're going to take questions from the reporters that are on the line. So I've already got some people queued up. If you have a question, just let me know in the chat window, please. And Allie, I'm going to unmute you first, if you don't mind saying your name and your outlet and then what your question is.
Sure. Thanks for doing this. This is Allie Morris with the Dallas Morning News. I was wondering, you know, obviously the governor put out a bunch of checklists in his plan for recommended standards. Are those requirements for restaurants that open, or are they simply recommendations? And, you know, those include things like no tables of more than 6 people, a hand sanitizing station at the entry, and use of disposable menus.
Yeah, those are all protocols that must be followed. So once he signed those into law through his executive orders, those are the minimal health protocols that all restaurants will need to begin following tomorrow that open their dining rooms.
Okay, great. Let's go over to Greg. Go ahead, Greg.
Can you hear me?
I can.
Oh, okay, great. my question was, who is monitoring, what government agency monitors the 25% capacity in case, I sort of anticipate people might start reporting restaurants. They look too crowded in there or something like that, And so in that instance, who takes charge in making sure that the restaurants are complying with 25%?
Do you want to take that, Kelsey, or I can?
I'll let you start, Emily.
Yeah, so it really depends on the jurisdiction. We've seen fire departments step in to do occupancy calls. The health department in some cases will monitor occupancy. I think that the guidelines are a great tool for everyone to follow. That shows the 25%, it shows 6 feet apart of spacing, it shows the 6 people per table. And so we've really created a checklist, and we think that depending on the city or town you're in, it will depend on who monitors it, but it is local. And as Governor Abbott stated, really it's enforceable. And so we've really encouraged and really made sure all of our restaurants are aware that beginning tomorrow, as they think of reopening, these are the protocols that they must follow, and that local authorities will be monitoring it.
Okay, great. Anything to add, Kelsey?
No, that's what I was going to say. I think the locals will continue to enforce, the health and safety restrictions like they do now.
Mm-hmm.
Perfect. Maria Mendez?
Hi, this is Maria with the Dallas Morning News. How did the confusion over employees being included in that 25% occupancy arise?
I don't know. I can't answer that. I know that what we do is we get the questions once things get released. And so we went immediately to the governor's office as the representative for the restaurant sector, asked them to clarify, we knew from an occupancy standpoint by including essential workers, it would really bring down the intent of what he was trying to accomplish with the medical experts when he set this percentage. And so it was really just about getting clarity and then providing that clarity to the different districts or jurisdictions across Texas. So, anytime an order is released, we usually have to go through it, and then we go back with this is what the intent of the order is. And I think the fortunate part for us is we've been very close and in lockstep with the governor's office to make sure there's one voice as we walk through these different phases together. And so we were able to quickly reconfirm the occupancy and the percentage, and of course now have that document in writing from the governor's office as well.
Yeah, I'll add that I certainly don't think this was the only point of clarification that's been made, right? I mean, they're operating on a super quick time frame, and just inevitably when you're writing a document or a law or executive order, there's going to be questions of interpretation. So we feel very lucky that we were able to get that clarification from them so quickly and so definitively.
Okay, Mike Ford.
Hey guys, Mike Board with WOAI News in San Antonio. Thanks for doing this, first of all. I want to ask you about staffing. We have heard reports about hesitance of some restaurant workers returning to the front lines when there's still not a coronavirus vaccine. Has there been a problem? Have you heard about problems getting employees to come back? What guidance are you giving to restaurants who might say, I want to come back, but my employees might not want to? And do we expect that this is going to be a problem getting employees to come back?
Kelsey, you want to take that? Or?
Sure. Yes, we are hearing that that's a problem. I don't think it's unique to the restaurant sector. I think you see this in retail and other businesses that are ramping back up. We actually had a webinar this morning with the Texas Workforce Commission to discuss some of these questions and kind of the practical logistics of how a business should go about trying to bring employees back, particularly if they're on unemployment benefits right now. The good news is there are some tools to help. One thing that we're going to be working on is promoting the shared work program, which is a program that allows businesses, instead of laying people off, they can reduce the hours of a group of employees, and then unemployment benefits can supplement the difference. So it's really a win-win for the business and for the employee, particularly in times like this where we're ramping up gradually. And so there just aren't going to be the same hour needs for the business. But of course, we need to see those employees be made whole too. And so, there are tools like that. We're talking to our restaurants about how to approach their staff. One of the things that's most important and that the TWC has emphasized is the employer working with their employee and communicating to their employee how they're going to keep them safe, right? And so going through the governor's statewide protocols, going through the Texas Restaurant Promise, explaining all of the different enhanced sanitation and social distancing policies. That's really going to be key, because it's going to be a partnership, right? We need employees and employers to come together, and that's the only way this economy is going to grow, right? We've got a lot of people on unemployment right now, which is certainly an important stopgap measure. But if these businesses disappear and aren't here in a few months to pay employees, we're going to have a really bad problem. So we're emphasizing that partnership, that collaboration, and the clear channels of communication.
Perfect. Kevin Reese, you are up now too.
Okay, thank you. I apologize if you're looking at Bill Murray while I'm talking. That was left over from this morning's Zoom meeting, but I'm sure you understand. Do you have any indication of just how many businesses, restaurants are, in terms of raw numbers, are too concerned to reopen? I know some that are extremely small here in Dallas that don't feel safe enough to open yet, or, as we've all been talking about, simply can't make a profit at 25% occupancy. Do you have any idea or guidance for them, or just how widespread that belief is among restaurants?
Yeah, in a survey we did, which is sort of a quick survey yesterday across the state, it was about a little bit more of no, we're not going to open tomorrow, we're going to wait, or open on Friday, we're going to wait to see how things go. We're going to wait to make sure that we're ready. I've seen some restaurants say we're going to learn from some of the larger restaurants that are choosing to open, and we're going to watch their best practice through the weekend and into next week. Many of the folks that responded who said they're not opening on Friday did indicate they plan to open in the next several weeks. We project across the state that we have about 2% that have permanently closed, and probably by next week it'll be a good 10% that just will never reopen. And so our job right now is sort of twofold. It's to get those that have the ability to reopen to begin the process if they can, giving them as much support. Our distributors, our partners, the suppliers have been extraordinary to help these restaurants get back up and running. And then it's really to do it safely and to make sure that everyone follows the guidelines, so that on the 18th, which is the next checkpoint right now, is that we can move to phase 2, which is to increase that occupancy to at least 50%. Again, not sustainable for a long period of time, but could just be enough to show from a virus management standpoint, the data for the governor's medical team to see that we're able to keep things in check and not see flare-ups across the state by doing this way. And even frankly, having some restaurants wait on the sidelines speaks to another soft opening, which allows us to hopefully sustain the opening. And so we are not surprised by the numbers. I think this is the first time we've seen the industry ever go through this, but we do know there's caution, but I think we were more surprised at how many are going to choose to open. And I think that's a very good sign.
And I'll add too, we continue to ask the public and our supporters, continue to support your local business with takeout and delivery, even after May 1st, because this is going to be a really long, slow road to recover, even for those that are able to reopen quickly. We did one survey, let's see if I can find the number quickly, but it was a majority of the restaurants we talked to said it would take at least 9 months for their sales to return to where they were on January 1, 2020. So this is going to be a long process, and there's lots of different ways that folks in the community can support their local restaurant, even if they're not ready to return to the dining room yet.
Gabriella Vidal.
Hi, I'm Gabriella Vidal. I'm with CBS Austin. I actually have 2 questions, but I'll ask the one that's in the thing first. A big thing with cities right now is making sure we're protecting the most vulnerable right now. What recommendations or policies are you putting in place or recommending that businesses do when it comes to bringing back employees who may be more immunosuppressed? And then the second question I had was, with regards to people choosing not to reopen businesses, is that in part because they can't afford to make the necessary changes to open safely, as disposable menus, place settings, and moving around tabling and stuff like that? Is that more expensive than opening?
Yeah, do you want me to take the first one, Kelsey?
Yeah, that sounds great. I'll take the second.
Okay. Yeah, I think, one of the things we're talking a lot about is the numbers that the governor released on Monday was 76% of the individual or fatalities, unfortunately, in Texas have occurred in population 65 and over. So we know that immunosuppressed or those that are more high risk or vulnerable or most vulnerable in the state. One of the things that we're encouraging restaurants and all community citizens to think about is how are we going to continue to support those individuals. So we know that we won't see them in our restaurants. The recommendation is that they stay home. But at the same time, we need to ensure they have access to food and they have access to support. So one of the reasons we see so many restaurants continuing delivery, curbside, and takeout is just for this reason. When it comes to the employee question, I think that's conversation between the employee and that manager. There's lots of discussions about what can and cannot happen under the Families First Act, which would give them some protection. But as we talked about with the Texas Workforce Commission this morning, it's really about creating the most safe environment. And for those that do have a medical condition, they certainly can have that conversation. And can't imagine a restaurant forcing someone to work in that situation. So I think for both sides, right, customers, we definitely want to be very safe, encourage those that are at risk to take one of our other options, right, to enjoy our services. And for employees to have that conversation with the manager, I think is the best advice we can give.
Agreed. And on the second question, there's no doubt that the economics are part of this decision whether to reopen or not. I mean, these are businesses, so they of course need to think about that and not just the immediate economics, but the long term as well. And I'm glad you mentioned sort of the cost of reopening, because that's something that I think gets lost sometimes in this conversation. For an industry that has just been gut punched, it takes a lot to reopen. You've got to repurchase food. You've got to rehire employees. You've got to buy, hand sanitizer, soap, all these disinfectants. You might be doing face coverings and gloves. And of course, we know there are supply chain issues with pretty much every item I just listed. So, it's a struggle, but we continue to be amazed probably isn't even quite the right word, with the resiliency of our industry. And they find a way, and it's really great to see. And we have no doubt that they'll keep doing that. But we continue to say, any restaurant, Governor Abbott was very clear, this is not a mandatory reopening. This is an option. And those restaurants who are ready and do think they can do it safely, that they can move forward. But no one should feel pushed into that.
Mm-hmm. Eric?
Yeah, hi. So the one thing I was wondering actually is that the Texas Eric Sandler from Culture Map. The Texas Restaurant Promise suggests masks and gloves for employees, but doesn't require them. And I was wondering why that's the case.
Yeah, so the Texas Restaurant Promise, when we updated the guidelines with the governor's official health protocols, there's not a requirement for mask and gloves, as that's really from the governor's order. We truly believe that restaurants will respond to their customers, and that customers will vote with their feet. And so customers are going to dine where they feel the most safe. And so I believe the reason they're called the minimum health protocols is really because that's the minimum standard that allows people to operate. And we do know that some restaurants are choosing to have face coverings, maybe masks or not face coverings. And that's really going to be the choice of the individual restaurant, not part of the official law of the executive order. And I think what you're going to see, and we're seeing it now, is some restaurants do actually have access to those supplies. Some are having trouble finding some supplies, and some are laying out their business and choosing to see what's best. But I ultimately think it's the consumer that will go to a place they feel safe and then return to a place where they feel safe. And so I think you'll see restaurants always maintain the minimum because it's required, but also start thinking about what they can do to build a sense of community and a sense of comfort inside their dining room. And that may come in a couple different forms and fashions over time. I think we're going to learn a lot in the next week.
Great. We're going to go back to Allie for her follow-up question.
Sorry, just to follow up. So the governor's office actually told me that those minimum standards were strong recommendations, but not mandates. And so I was just wondering where I guess you stand on that, and what they actually are for restaurants.
Yeah, well, I guess where we stand is when the governor listed these out as the minimal health protocols, we put them in the promise as a commitment between restaurants and consumers that if they dine in an establishment, they know these things are happening. And so that's really where the Texas Restaurant Association comes in. Local enforcement, that is going to be up to local enforcement to determine. But I think that I would be hard pressed to tell a restaurant that they shouldn't meet the standards that have been outlined, because the health protocols were designed with the governor's medical team as health experts as really a way to help it open safely. So as far as we're concerned, we're presenting them as this is what we would like restaurants in Texas to do to safely reopen at the 25%.
Absolutely. I mean, again, the emphasis is on a sustained recovery, and we're not going to get there if we're, trying to be cute with the rules, right? This is not the time to stretch it. This is the time to follow the minimum guidance that we've received from the medical experts and Governor Abbott's team.
We're going to go back to Matt for a follow-up question.
Hey, thanks. I wanted to ask about, there will likely be a situation that arrives where a diner shows up at a restaurant and is clearly is putting the restaurant in a situation where they have to decide about they don't want to allow this person inside, whether they're flaunting the rules or that they might be sick. There's going to be a confrontation between some diners and some restaurants who want to put safety and protection first, and a diner who may not violate that, and there might be a problem there. How are you telling restaurants to handle a situation where they might have to ask someone to leave because of the coronavirus rules?
I'll jump in. We're definitely having those conversations with our restaurants. I think some important things for them to think about now is making sure they have the policies in place, which is where the Texas Restaurant Promise really comes in handy. So those rules are set in place ahead of time, and then they're applied on a non-discriminatory basis, right? Health and safety have to come first. And we're emphasizing that to our restaurants, which of course they already know. They're the experts in that. And we made it a part of the Texas Restaurant Promise from the beginning that a customer has to see the promise on the exterior or at the entrance. And part of what's in the promise is I agree to follow the sanitation and social distancing guidelines that have been put in place to protect me, other customers, and employees. And so we're trying to create that collaboration, if you will, right from the get-go, and set that expectation from the front that this has to be a collaborative effort, and everyone is going to be held to these minimum health standards.
Yeah, and I think that if you look at the checklist that was released with the minimal health protocols for customers, across any of the sectors that are reopening, there's this notion of self-screening. So across not just restaurants, but retail and others, the idea of self-screening against a number of categories before you actually go into the physical building where you may be traveling to, I think is a really important. But as Kelsey said, we're also giving them talking points, how to have this conversation. How do you talk to someone who maybe does come in and display some of these symptoms, and obviously not discriminate at the same time. And that's one of the reasons why I think still having options for contactless delivery. So if you're not feeling well, we're happy to bring the food to your car. We're happy to deliver it to your home if possible, but giving people all those options to enjoy our services without maybe putting risk to employees or to diners that are in the dining room.
Great. Thank you, ladies. I don't have any other questions in the queue. I'll give it a couple more seconds in case there's some reporters formulating their next and last brilliant question. No. Okay, great. If you need the recording, please just reach out to me. I'm Anna. You all have my email address. I'm happy to send that over to you guys. Otherwise, thank you so much for joining us today, and good luck with all your reporting stories out there tomorrow.
Appreciate your time.
That was the conclusion of a video conference with members of the Texas Restaurant Association, the trade group that represents many restaurants here all across our state. What they're in particularly wanting to talk about today are some of the concerns that restaurants and customers, quite frankly, have, a lot of us have, about being able to go back to restaurants that are allowed to reopen starting tomorrow at 25% capacity if you live in an area that has more than 5 positive COVID-19 cases. places that have fewer than 5 confirmed cases can reopen up to 50% capacity. So there is that bit of a discrepancy in terms of areas that have been hit hard by COVID-19 and those that have not. I want to show again kind of the rules that will be going into effect tomorrow. So effective this evening at midnight, the stay-at-home order for the state of Texas will expire. The governor made that announcement not too long ago. In addition, he said that all retail stores, restaurants, movie theaters, and malls can reopen on May 1st, tomorrow, if they can maintain a 25% occupancy rate. And you see that point listed there on that graphic. Bars, hair salons, and gyms, however, have not been given a date when they can reopen, potentially mid-May, but that official date has not been set or announced just yet. We, of course, will follow along with that. The Texas Restaurant Association did tell us and sent out some information that it conducted a poll among members in its organization. It got 401 responses, and this is one poll result in particular. The first question they asked the people who were responding to this poll was, do you plan to open your restaurant on Friday, May 1st? As you can see, it's pretty evenly split. 43% said yes, 47% said no, and then another 9% said they were unsure. So, again, we've been trying to track this as well. There is not one clear mandate about what people are going to be doing. Some places have expressed some skepticism about reopening and trying to figure out if it's even worth doing so, being able to allow 25% of its occupancy in. Is that enough to be able to sustain employees, the food supply, keeping the business open? That's all a question. So this kind of shows you, again, it's a pretty even split among restaurants here in the state about whether they're going to reopen tomorrow night. A lot of places are still doing takeout and delivery, and I've heard from many different people here in the community that's what they would prefer to do right now because there is not widespread testing and cases still keep going up here in our state. So that was the answers in response to the first polling question that you see right there. Here's a second one, and I want to make that full screen so you all can see it. The Texas Restaurant Association asked, if you do not plan to open May 1st at 25%, do you plan to open when you can go to 50% on May 18th? Because that was when phase 2 of the governor's reopening plan is supposed to take effect. Still, some people say yes, but the majority says we will be already open at that time. As you see there, it's 47% said they'll already be open by that time. So they'll be allowed to just expand their operations if they choose to. The third question in this poll is, are you located in a county that can open at 25% occupancy or 50% occupancy on Friday? And most people said they are allowed to open at 25%. 88% said that particular answer. Again, there is a discrepancy, a difference in when certain restaurants are allowed to open to certain crowd sizes. So if you live in an area that has 5 or more positive COVID-19 cases, you can only open that restaurant up to 25% occupancy. If you live in a place that has 5 or fewer positive COVID-19 cases, you can open up to 50% occupancy. But according to this poll, which the Texas Restaurant Association did, most places are saying that they are located in a county that can only open at 25% occupancy because there has been widespread COVID-19 cases all across the state. And finally, the last question they asked, if you have more than one restaurant, do you plan to open them all or a portion? And the majority of the answers said they responded and said only one restaurant that they have, and then that's what they'll open at that time. We're going to put this video that from the Texas Restaurant Association that its members held just a few moments ago. We're going to put that on our website, KXAN.com, and on the KXAN News app. You can watch it there if you happen to miss any of the discussion that was happening at that time. So we'll take this down and put that up online for you all. Thank you all for watching. We hope you enjoy the rest of your Thursday. Please, everyone, stay safe and healthy, and if at all possible, still at home. We'll see you later.